public health physician, also an epidemiologist and retired director of disease control and immunization at the Primary Healthcare Development Agency, Dr. Emmanuel Abanida. He joins us from our Abuja studios. Thank you so much, Doctor, for joining us on the program. What do these figures tell you?
Thank you very much. Well, the figures are there, and as we have said, they are figures. But I think we have to look at these figures within the context of standardizing what goes on in the north and in the south. If you are testing one per perhaps maybe 10,000 people in the north, and you are testing one per 5,000 people in the south, obviously the figures will be slightly different. I want us to be circumspect about these figures because we have not achieved the optimum testing rate. And if we look at the entire country, we found out that about 20% of all the cases that are tested have become positive on the average in the past 3 months or so, and an average of between 40 and 45% of all the cases that are positive have recovered from the disease, and we are having a mortality rate of between 1 to 1.6% as occurring. I think dividing it to north and south may be misleading, because are we testing the same number of people per unit population in the south or in any state in the south compared to testing the same number of people in the north by the same population? Nigeria is testing an average of about one person per 1,500 people, which is extremely very low as compared to a country like South Africa that is testing about one person in 36 people. So until we are able to ramp up and we have achieve an optimum number of testing either in the south or in the north, then we cannot have a comparison. You cannot compare two quantities or two data that probably don't have the same denominator. That's my take about that. I think we need to be a bit circumspect about this consideration. Let us know that on the whole in the country, we have a test positivity rate of about 20% on the average, recovery rate on the average of 40%, and the case fatality rate of about 1 to 2%. And that has a lot of implication for the national figure if we are going to look at it globally, nationally. What it means is that
Dr. Abanida,
perhaps maybe about 20% of Nigeria, if we test about 200 million people, Nigerians, about 20% of us will be positive. And you may have about 40% of those that are positive that may recover and may have a case fatality rate of about 1 to 2%, which represents perhaps maybe about 4 million Nigerians out of about 40 million Nigerians that may recover. And these are the figures. I don't want us to say the north is this, the south is this. There are states in the south that are behaving exactly like the states in the north. And
I must quickly ask you, and this is if you can respond in just a few seconds, because we need to go, and that is there a possibility that if the curve in Lagos, which is the epicenter, is flattened, we're closer to bringing down the national COVID-19 curve in total?
Well, if you say the biggest burden appears to be in Lagos, and if we have an event that is bringing us to a positive trajectory in Lagos, certainly it is going to affect the national figure. But let's forget that what is happening in Lagos is in Lagos. And then we are talking about this COVID, we are talking on state-specific. We cannot transpose exactly what is happening in Lagos in terms of outcomes to what happens in another part of the country. It's just an example for us to see what's happening in Lagos and see what lessons are going on in Lagos. How are they flattening the curve? What are the responses they are giving to cases that have been detected or those who are positive? What's happening in the isolation center? And what is happening in home care that is now becoming the crux of the whole thing?
We'd like to thank you.
Lagos is making a lot of efforts, but we also know that there are a lot of intense community
mission that's ongoing.
In Lagos.
Thank you so much.
More than any other country, yeah.
Thank you so much again, Dr. Emmanuel Abanida. Thank you so much, epidemiologist. Thank you for joining us on the program.